by Babalwa. We can start now.
Thank you. A very good evening and welcome to BaseMed Medical Schemes Information Session on Pace4. My name is Babalwa Siele. I'm the Regional Key Accounts Consultant at BaseMed, and I am joined by panelists who will be taking questions. So I think the Q&A is open. You are welcome to ask questions during the presentation, and then they will attend to those questions. All right, get started. Okay, so on tonight's agenda, we'll be looking at the benefits for 2023 on the Pace4 option, looking at the hospital, out of hospital, chronic medication benefits, the preventative care benefits, our tempo benefit, which is our wellness benefit, the savings and contributions for 2023, and we will then take any questions that you have. Getting into the information on Pace4, so your medical aid is primarily then split into three main benefit blocks, being your hospital cover, your chronic cover, and then your day-to-day benefits. And then in addition to that, we also have preventative care benefits as well as managed care programs. So very important to note on the pre-authorization side, the most important thing is the information that you need if you require an authorization. This information will then be provided to you by your treating doctor. In some cases, the treating doctor will then request an authorization on your behalf. And then on the screen, we have the number that you need to call if you require an authorization, as well as the email address that you can use. So on the hospital benefit, a pre-authorization is required prior to an admission into hospital. And this is then done by our pre-authorization center. The accommodation, which is then the hospital stay and theater fees, do not have an overall annual limit. So your medical aid does not have a rand limit. The limits are then applicable to the doctor's fees, where we pay the medical scheme or the medical scheme tariffs, and certain procedures that have an annual limit, like your prosthesis limits, will then be applicable as well. So we pay the medical aid claims at 100% of the scheme tariffs. There are rules and protocols that apply. This information is then provided to you when you request an authorization, and you are then advised what the rules and the protocols are. And then very important is that for mental health treatment in patient, we provide a benefit of 21 days per beneficiary per year. And then treatment for chemical and substance abuse is limited to 21 days or 35,573 rands per beneficiary per year. We have a network of facilities that members can then use should they require an admission. These are then also then available to you on request. So you can get this information, it is readily available. And then on the major medical and maxillofacial surgery, it is covered at 100% of the scheme tariff. And your dental and oral surgery on the Pace4 option is limited to 22,233 per family. So this would include things like your orthodontics as well, which will then be subject to that annual limit. Then your prosthesis limit is 148,004 rands per family. It is covered at 100% of the scheme tariff. And then here you need to also then make use of a preferred provider. Then your external and internal prosthesis apply as well at 34,135 and 40,000 respectively. So then the internal prosthesis is then for your functional prosthesis, and that then is the limit that you see at 40,000 rand. Then continuation on your hospital benefit, your vascular prosthesis limit has increased from 45,000 to 69,000. We would have advised or shared information that our benefit limits were at 5.7%, but you will see some of our prosthesis limits were increased by more than the 5.7%. And this is because that as a scheme, when you request an authorization for these cases, it is then sent through to our quotations department, and they then check on if it is above the limit, then check with our preferred providers if a preferred provider can provide that within the limit. So you'll notice that some of our limits have increased by just above 100%. And this is because then we've tried to then bring it in line with the industry pricing that we see. And the challenge that we then faced was that some of these pricings were lower than what the industry requires. So you'll see that on most or some of these, some of the increases on prosthesis were then a lot more than the 5.7 standard increase on our benefit limits. And then your refractive eye surgery is then at 100% of the scheme tariff and limited to 11,117 rands per eye. And then on the Pace4 option, we also cover medically necessary breast reduction surgery at 100% of the scheme tariff at an annual limit of 52,850 per family per annum. Now, this limit only includes the fees for the surgeons and anesthetists. The stay, the hospital stay and the theater fees will then be paid from the risk benefit. So this 52,000 rand does not include your theater and accommodation fees. And then our palliative and home-based care, this is then as an alternative to hospitalization. It is covered at 100% of the scheme tariff and also has an annual limit, which is 126,840 per beneficiary per year. And then our out-of-hospital benefits, like I said, we then have the benefits broken down into 3 major benefit blocks. So we're covering our out-of-hospital benefits. So the main benefits or the most common benefits we will look at will then firstly be the MRI or the CT scans. We pay 3 per beneficiary per year. And then the PET scan, we pay 1 per beneficiary on the policy per year. Wheelchair is covered at 15,564 per family per 48 months. So every benefit that specifically stipulates months is then up to the last month and not every 4 years or 24 months respectively. So the hearing aid is then covered at a limit as well. And that is also per beneficiary and also per or every 24 months. Rehabilitation services following a traumatic event is then unlimited, but it requires an authorization. Protocols do apply in this case as well. And then your continuous or flash glucose monitoring is covered at 26,425 rand. And this limit is per family per annum and also requires an authorization. Insulin pumps, which then exclude the consumables, is then limited to 46,259 per beneficiary, and that is every 24 months and also subject to pre-authorization. Then looking at the benefits for medicine, this is primarily then based on our chronic benefits. And then so with our chronic benefits, we have CDL, which is the chronic disease list. This includes a list of 27 chronic conditions that all medical schemes are required to cover by law. And then 18 PMB conditions that require medication, as well as 29 on the Pace4, we cover 29 non-CDL conditions that would then be covered subject to certain limits. I will get into more detail on these as we go through the slides. Just note that the treatment that is specified in the treatment plan is then the treatment that is prescribed by the Department of Health, and it is in accordance with the treatment protocol. So this is then for each and every condition, there is a prescribed treatment protocol that every scheme then follows. We follow these, and then when we approve a chronic condition, it is then accompanied by a treatment plan, which then includes a basket of benefits. I will get into these benefits as well, but different benefits apply to different chronic conditions. So when you get your treatment plan, you'll notice that certain things will then be included as well. Things like your consultations to renew your prescriptions, and certain conditions will also have pathology or radiology that is related, which will then also form part of this treatment plan. So just a look at I will not go into detail on all the chronic conditions that are covered. So this is the CDL list that is covered on all the options. You will see very common conditions like your diabetes, hypertension, high blood pressure, your asthma, HIV and AIDS, which are then all covered in accordance with the CDL condition protocols. Just remember that this information is also available on our website. And then these then are the non-CDL conditions. These are then considered not necessarily life-threatening, but they are then on the additional list of chronic conditions because they still require management, ongoing management as a chronic condition. So here you will find conditions like your acne, eczema, major depression, just to mention a few. Then all the conditions are then listed on the screen. And then your benefit for chronic medication. So your CDL conditions are then cover for these conditions, or the benefits are unlimited. So there's no annual or rand limit for these conditions. And then the medication for the additional list of conditions, which are then considered the non-CDL conditions, are limited to these amounts. So for a single member on the Pace4 option, the limit is 21,905 rands. For a family, so a member plus 1, 2 or more dependents, the limit is 44,009 rands. These are then covered at 100% of the scheme tariff for the approved medication. And then a co-payment of 10% applies if the medication is not on the formulary. So the formulary is then the list of medication that is covered in full for each condition. This list is available to all members. It is on our website, and for each and every condition, the list is then available. So this list can also be shared with your treating provider in cases where you are then applying for a chronic condition. So we use the Medisco reference price, which is then referred to as the MRP. And this is a generic reference price that is applied to all approved medicine. So it's available to most medical schemes that then use this as a reference price to then set the limits on the non-formulary medication. Okay, so a continuation on your benefits for chronic medication. So your approved CDL, PMB, and non-CDL chronic medication is paid from a limit first, the limit that we then we then looked at for, which is then applicable to single members and families. Thereafter, the conditions that are listed as CDL and PMB will continue to be paid unlimited. So we'll first pay from the limit that was stated, and thereafter the CDL and the PMB chronic medication will then continue to pay from the risk benefit. Your approved medicine claims for major depression will then continue to pay from risk, even once the limit is, the non-CDL limit is depleted. So the condition itself is on the non-CDL list, but medication or treatment for this condition then continues even after this limit is depleted. And then the approved medication for the below conditions is not subject to the limit, the non-CDL limit, and it will pay directly from risk. So from then day one, it will pay from risk. So therefore, we then do not pay these claims from the chronic limit. And that is for organ transplant, chronic renal failure, MS, and hemophilia. And then just more information on this, the CDL specified medication and treatment is then covered according to the PMB provision, which is the prescribed minimum benefit. And the treatment also then needs to be provided according to the standard treatment algorithms for each CDL condition. And then has to be provided according to the standard treatment algorithms for each CDL conditions. Then the scheme, we as the scheme then also provide cover for the related doctor's consultation tests and tests related to the condition. So this is then the treatment plan that I referred to earlier, that certain conditions, or there is a treatment protocol or treatment plan for each condition. Then as you then have the condition approved, the treatment plan is made available to you, which will then include or detail the basket of care that will be included in your in your treatment. So your consultations, related blood tests or radiology, etc. So to obtain an authorization for chronic medication, your treating doctor is then required to complete the BestMed chronic medicine application form. There's a section that you as the patient also then need to complete, or the member needs to complete. We do advise that you then make the treatment, the medicine formulary available to your doctor, or share this formulary with your doctor. So certain every condition will then have medication that is on the formulary. The medication that is on the formulary, the scheme will then cover in full with no co-payments, and non-formulary medication will then have the 10% co-payment that I mentioned earlier. So this formulary is available on our website for each condition according to every option. So then as you're applying for your chronic benefit, it is then advisable that this formulary is then available to your doctor. Remember that these items have the same active ingredient as the either the non-generic or the items that are not listed on the formulary. So in most cases, then your doctor will also be comfortable with the items that are on the formulary. They may have prescribed something that is not on the formulary, but if the formulary is then available to them, they can then assist you in making an informed decision on taking medication or selecting medication that is on the formulary to then avoid these co-payments. So if you then are moving, say, from another scheme, or adding a dependent that's moving from another scheme who is already registered on chronic with the current scheme, you can submit a chronic letter. So from the previous scheme, we'll accept a chronic letter along with a copy of the latest prescription or the current prescription. Remember that it should not be older than 6 months. So we will then use the chronic letter and the prescription to register the condition. So which means that then you will not be required to cover another consultation fee while you still have a valid prescription. So that we can use to then register the patient on a chronic benefit with BestMed. And then any chronic related queries must be emailed to medicine@bestmed for processing, or if you have any queries that are related to your chronic, these can be directed to medicine@bestmed.co.za. So for a first-time applicant, so an existing member who then needs to apply for chronic cover, we require a completed and signed application form, as well as supporting information. So this could be blood tests that are then submitted or were done by the doctor, which will then be for specific chronic conditions. There's specific supporting documents that are required. And then new medicine, that if you need to then add new medicine to an existing authorization or to update an existing authorization. So you're already registered for diabetes, but you then need to add medication. There's been a change to your treatment. We then require a copy of your new prescription from your doctor and any supporting information. So that is then still also again applicable to then the chronic condition that is being applied for, or the changes that are made to the specific chronic condition. And this information can also then be sent to medicine@bestmed.co.za. Doctors are also then able to obtain telephonic authorizations by speaking to one of our pharmacists directly. So then this would be done by the treating provider. Then getting into the PMB conditions. So if you'll remember that I mentioned that then there's also an additional list of PMB conditions, 18 conditions that require treatment, ongoing treatment. And these then are the conditions that then have medication covered. These conditions are provided to all our medical aid members, and then they also include provision for diagnosis, treatment, and costs of ongoing care. So then you'll see that even COVID-19 is on the list of the prescribed minimum benefit conditions that require ongoing care. Okay, so the process for registration for a PMB condition, you then would need to download the PMB registration form. This is then different from the chronic benefit form from our website, or you can then contact your key accounts consultant. If you're part of a participating employer group, your key account consultant can then also assist with the form, and then your treating provider would then submit the completed form to pmb@bestmed.co.za. So then if it is one of the 18 conditions, this is then the process to follow. It is different from the process that we follow for our CDL and non-CDL applications. Very important to note is that where treatment for PMB is concerned, designated service provider networks apply. So you then need to make use of a designated service provider. That is one of our contracted doctors to obtain, even for your treatment, you then need to make use of our designated service provider. Then in more detail on the formularies and co-payments, all our formularies, as mentioned, are then available on the BestMed website. This is for all the CDL, non-CDL, as well as PMB conditions. And then the formulary medication is not automatically approved. So an authorization is still needed to gain access to the medicine benefits. So then the processes that we discussed would then be applicable in each case. And then to avoid co-payments, as much as a scheme, we cannot dictate the to providers on the fees and the fees that they can charge. We then make use of formularies to protect members against co-payments. So to avoid co-payments, we advise that you make use of formulary listed medication, or you use generic medicines that fall medicine with prices that fall within the medicine reference price list. Okay. You make use of designated service providers that do not charge higher dispensing fees as well. Okay. So these are then also available. You can make use of pharmacies like your Clicks, your Discam, your Medirite, Van Heerden pharmacies, Pick and Pay pharmacies that are then our designated service providers. And then your acute medication. So your acute medication would then be your non-chronic medication prescribed by your doctor. It is then, that is limited for a single member to 9,809 rands. For member plus 1, 2 or more, so for a family, the limit is 15,237. A 10% co-payment will apply on all acute medication, and this is subject to the overall day-to-day limit. So on the Pace4 option, members that are on the Pace4 option will understand that you first then have a savings account, and then above that, you also have the overall day-to-day limit. So these limits are subject to then the main overall day-to-day limit. And then your over-the-counter medication is then paid from the savings account. Biological medicines on the Pace4 option, which is then used in some cases for oncology treatment, is covered up to 541,971 rands, and that is per beneficiary, per benefit year. And now getting into your optical benefits, remember your optical benefit on the Pace4 option is a standalone benefit. It doesn't cover from your savings account or your overall day-to-day benefit. You will then have to make use of PPN, which is our preferred provider. The telephone number is on the screen. You're also then able to visit the PPN website to find a provider in your area. So these would then include different providers. So from your Toga Optical, your privately owned optometrists, your Specsavers. So the best is then to visit their website and find an optometrist, the PPN approved optometrist that is in your area. The benefit is available every 24 months from date of service. So again, emphasis on the 24 months and not 2 years. So it's 24 months from the last date of service. Then you're the network provider. If you're making use of our network provider, one of the PPN approved optometrists, will then cover the consultation, which is 1 per beneficiary. We then cover the frame up to a limit of 1,040 rands. And lens enhancements are covered up to 750 rands. So then that would be your tint or anti-glare, any enhancements that are then made to your lens. And then at 100% of cost, we cover the standard lens. So this your single vision, bifocal or multifocal, and your lens enhancement at 750, or you can utilize your entire benefit for contact lenses, and that will be limited to 2,375 rands. If you're then making use of a non-network provider, the consultation fee will then be capped at 365 rands. So if there's any shortfalls on that, you will then, as the member, be liable for the difference. The frame is kept at 780 rands. The lens enhancement still at 750 rand. And then there's limits to your lenses. So your single vision at 214, bifocal at 460, and your multifocal lens at 982.50. Or you would then use, if you then prefer contact lenses, you then use the benefit on contact lenses capped at 2,357 rand. Then your maternity benefits. So at 100% of the scheme tariff, we have a maternity program that will then cover at that rate 9 antenatal consultations at a family practitioner, also then known as a GP, gynecologist, or midwife. Remember that this maternity program also does not pay from the savings or overall day-to-day benefits. This is also a standalone benefit. And then you also have 1 postnatal consultation, also with the GP, gynecologist, or midwife. 2 ultrasounds are covered, 1 between 2D ultrasounds, that is, 1 between 10 to 12 weeks, and the second one between 20 and 24 weeks. These can also then be done with a GP, gynae, midwife, or at a radiologist. We then also cover supplements from the maternity program. And these are the supplements that are categorized as maternity supplements and claimed up to a maximum of 127 rands per claim. So things like your Preg Omega, your Chelapreg would then be covered from this benefit. And this is covered once a month and for a maximum of 9 months, so for the duration of the pregnancy. And then our preventative care benefits. So this is also another benefit, one of the benefit blocks that I mentioned that are in addition to the 3 primary benefits that you have on your medical aid. Preventative care benefits are also covered separate from your savings or your overall day-to-day benefits. So from your preventative care benefits, all the listed conditions are then covered. So your vaccines, flu, pneumonia, and mandatory travel vaccines. Your female contraceptive is covered at a benefit of 2,550, and that is per beneficiary. So that is per female beneficiary within childbearing ages on the policy. The benefit can also be used to obtain an IUD device, so like your Mirena or any other form of a loop. And we cover 1 device every 5 years, subject to that limit. Then your back and neck program, the back and neck program with DBC and workability is available to you as an alternative to back surgery. So in cases where a member is referred for back surgery, or they going for back surgery, we then place the member on the back and neck program to establish if physical rehabilitation or other methods other than the surgery would then not be suitable. So this is then not an open benefit. It is available as an alternative to back surgery. HPV vaccines, which will cover 3 vaccines for females between the ages of 9 to 26 years. Pap smears are covered for females from the age of 18, and that is covered every 24 months. Mammogram every 24 months as well, and that is for females over the age of 40. And then pediatric immunizations are covered. We cover the full government schedule, and this can be done at a private pharmacy. And we'll also cover baby growth development assessments, and that is 3 per year for children that are between the ages of 0 to 2 years. Preventative dentistry would then cover your cleaning, scaling, polishing, a consult, and your oral x-ray. Bone densitometry is covered on the option as well, and as well as prostate-specific antigen screening for males that are over the age of 50 or 50 and above, and that is covered every 24 months. Remember that the benefits that are available every 24 months from the preventative care benefit, if you then go for the benefit every year, the years in between will then be covered from your day-to-day benefits. So this is not to say that in certain cases you cannot have a pap smear done every year, but the preventative care benefit will cover these benefits every 24 months, which means that the years in between will then be covered from normal day-to-day benefits. And then getting into our Tempo journey. So Tempo is our wellness program. So we have four phases within this benefit. The Get Active, which is then your fitness journey. So after to activate the benefit, you then have to do you then have to do your health risk assessment. Your health risk assessment would then unlock your dietitian and biokineticist benefits. The journey then is available to all our members. So the fitness, you have your fitness journey, your nutritional health journey, which you can then embark on with a dietitian, your emotional well-being journey, as well as your preventative care benefits. We got into the preventative care benefits, and then we also recently launched a mental wellness benefit as part of our Tempo benefit. This benefit is already available to you. So if you have the BestMed app, I do invite you to then go on the BestMed app and get information on this as well. So this then getting into the emotional well-being journey, this as I've stated, this is a newly launched benefit. This was then developed by qualified psychologists, and the aim of this is to assist our members with identifying and managing emotions, and also managing or identifying the effects that your emotions have on your mental health. So here we then provide you with information on lifestyle or lifestyle related information, which will help you deal with life's changes and curveballs. We've all dealt with, I think just coming out of COVID, we've all experienced, what the effect that it's taken on our mental health. If it was not you, it could have been a friend, it could have been a colleague, but we all just, and we all then understand what the effect has been. And then also look at the practical challenges that will enable you to practice new life skills that you've acquired. So you have a guide that is then available. So you can navigate this journey on the member portal, on the BestMed app. So if you do not have the BestMed app, you can download the app if you are using an iPhone on iOS or Android device. It is then available on the Play Store. And members that are using Huawei devices will be redirected to the journey via our member portal. So I do invite anyone who is here, firstly, to download the BestMed app if you do not have it, and then also just to explore this new benefit that is then available to all our members. And then on the day-to-day benefit, This is then the last benefit block. So if we look at the day-to-day benefits, we're looking at the savings account and we're looking at the overall day-to-day benefits as well. So the annual savings account, remember these are then the day-to-day benefits is all the benefits that are not listed as scheme benefits. So any outpatient benefits, your GP consultations, specialists, prescribed medication, blood tests, x-rays, all these benefits that don't have either have a standalone benefit or are not listed as scheme benefits will then cover from day to day. So once the scheme benefits are depleted, the benefits will then pay from your annual savings account. So on the benefit, you have two limits that apply. The overall limit, so for member only, the limit is 39,497. Member plus one or more, the limit is 63,693. So just the breakdown of the limits or the sub limits on the major limit or the major overall day-to-day limit that I mentioned. So your GP and specialist consultations, you'll see the limits applicable to each benefit group. So for member only or member plus one, you have the different limits that apply. Your basic and specialized dentistry also has a limit. Your supplementary services also then have a limit. This includes your dietitians, your biokineticists, your psychologists, your physiotherapists, etc. And then medical aids and appliances are then limited to 11,000. So these are your external medical appliances limited to 11,509 Rand. So things like your crutches would then cover from this benefit. Wound care is limited to 15,171 per family. Then you have your basic blood tests and x-rays and the applicable limits, as well as then your acute medication also with applicable limits. As I mentioned, remember that there's the main overall day-to-day limit. So these are then the sub-limits that apply to the different benefit groups. Then your annual savings account, then your 3% of your contribution. Your vested savings account, remember, would be any benefits that you've accumulated from previous years, or any savings that is unutilized would then sit in a vested savings pool. The rules that then apply to savings account expenses, we then only pay medical scheme tariff amounts from the savings account. So each claim will then be paid up to 100% of the medical scheme tariff. The over-the-counter benefits are paid from the available savings, and the claims will then must be received from registered healthcare professionals that are registered with the Healthcare Professional Council of South Africa. And these medicines need to be registered, and medicines, sorry, need to be registered with the Medicine Council. So we need a NAPI code for each medicine item that we then receive a claim for. Okay, then you will see there, that's the annual savings account. If you then, that's then applicable per family type. For a single member, 3,384. Principal member plus an adult or a spouse is 6,768. 2 adults and 2 children is at 8,352. Remember that this information then on the detailed brochure will then include what the savings allocation will be. So you can also work this out in accordance to your family type. Very important that the contributions for our child dependents, members pay only for the first 3 child dependents. So the rest are then free. So for a family with 4, 5 or more children, we only pay for the first 3 child dependents, and we cover child dependents up until the age of 24. The general age across the industry is 21. BestMed covers child or considered children as child dependents up to the age of 24. Following this then, the child up to the age of 26 has to be a registered student to continue enjoying the child dependent rates. So if then post 24, the child is not a student and is still financially dependent on you as the member, you may keep them on the policy. They will then start paying adult dependent rates. Contributions on the Pace4 option. For principal member, 9,411, as well as a spouse or adult dependent. And then the child dependent rate is 2,205. Very important is that these contributions are then the full contribution, 100% of the contribution. So if you are billed through a participating employer that has a subsidy, then the subsidy will then be applied after this contribution. So it will then reduce your contribution, but the 100% contribution on the Pace4 option is what we have on the screen. So should you need to then gain access to your personal information or any scheme information, our call center number is on the screen. Call center is open between 8 and 5 on weekdays and between 8 and 3 on Saturdays. Not available over a long weekend or public holiday. And then the email address is service@bestmed. Our WhatsApp number is on the screen, our fax number, our website is on the screen, as well as then our social media handles. Then the BestMed app, I mentioned the BestMed app with regards to the Tempo benefit. There's a number of other benefits that you can get on the app. The app, as mentioned, can be downloaded from iOS or Android. You will gain access here to your claims information. So when a claim is submitted to us, you will get a notification on your app. You're able to see your benefits and your savings. So you do not need to call through to the medical aid or our call center to confirm benefits. You're also able to view our network providers. So in instances where you then need to see a doctor or a specialist and you prefer to use one that is contracted to BestMed, you're then able to view this information on our website. It allows you to view the doctors by location, so where you are, or by specific location. So we can do a geo search on our website. Sorry, on our app. You're able to also then submit claims on our website, on our app, and gain access to the Tempo and wellness benefits. If you have any questions that my colleagues were not able to answer during the session, you are welcome to forward your queries to escalations@bestmed.co.za. We will then answer to these questions timelessly and then provide you with an answer. Okay, so I'd like my colleagues to then just maybe indicate if we have any questions that have not been answered on the Q&A, and we'll then have an opportunity to then take those questions, or if one of the panelists would like to then address a question verbally, you are welcome to do so. Paul, are we comfortable? No questions?
We don't have any questions. Okay, there's one that just came up. It says, for clarity, are all chronic claims paid out from the chronic benefits and not from the general benefits? But I see Jackie is replying.
Okay. Yes, so they should chronic claims for all the conditions that were listed. So the applicable conditions. So for CDL conditions, if the condition should be registered and paid correctly from the chronic benefit, and non-chronic or the non-CDL as well. If it is a condition that is on the list and approved, it should be paying from the chronic benefit. So if there is a case where it is not paid for from the chronic condition, the first thing we look at is whether it is approved or was applied for, but we can also investigate cases where it is not correctly paying from the chronic benefit if applied for. Okay. So the question is then addressed. Okay.
Thank you, Babalwa.
Prof,
Members,
yeah.
if you've got any questions, the members can just raise their hands and then we will unmute your mic and let you ask your question. Sorry about that, Babalwa. I can go ahead and ask Prof and answer Prof's question. Sorry.
Okay, I'd like Prof to maybe just clarify the question. I think is the concern on the benefit, because the member plus one benefit is more than the single member benefit. Just trying to maybe understand. Prof Olivier, you are welcome to unmute and then just maybe provide clarity on your question.
Yeah, good evening. My question is about the following. I see that there's been an increase of about 12.2% in the monthly tariff from 8383 to 9411. But basically, when you have two adult members, one is registered as a dependent, but both pay the full amount, current year 8383. But as one is the main member and the other is dependent, although paying the full amount, each of the two individuals, as a family, they are disadvantaged compared to when they would have registered as two independent main members, still staying the same premium. And the same, that applies in 2022, where there are in actual fact 14 instances where a family consisting of two full paying members are disadvantaged because there are limitations, 14 limitations in 2022. And you mentioned that there are in actual fact 5 categories in 2023 where the family limit or the family cap is in actual fact less than 2 times 2 separate adult members. That is for acute medication, day-to-day benefits, basic and specialist dentistry, wound care benefits, families, practitioners, and also a number of these special support, like, for example, if a family needs the 2 adults also need, let's say, a CPAP machine, and that cannot be done in the same year, taking into account the price of CPAP machines. So I would just like to know why this discrimination. And I've tried to take this up a number of times with BESMET in writing, and every time I was told at various levels, this is cross-subsidization. I understand cross-subsidization, but if the benefits for 2 full-paying adults as a main and a dependent, if those benefits are less than the benefits if they had originally registered as 2 separate members, each with its own number, and with dependent goes 00 instead of 00 and 01. I can't understand why this discrimination takes place, because it's to the disbenefit. And I know of no other medical scheme which at its highest level discriminate against people who pay each individual adult pays the same amount as the other individual. So I would like to know, why is this the case? And is BESMET willing to reconsider this? Because what now would happen is that, for example, in such a situation, the dependent might decide, well, I'm no longer going to be a dependent. I'm just transferring to become a full member in my own name. Still, BESMET doesn't lose any money because that person is still paying in full. And then that person will have full benefits. So I would like to have your views on this. Thank you.
Okay. Thank you, Prof. Yeah, okay, that is quite an observation. I think this is open for us to then also discuss with our benefit design committee. And I think if you do not mind, please just also leave your email address so that we can also provide you with information on this once received. I'm not sure if anyone of the panelists, maybe this has been addressed before. If anyone would like to then provide an answer to Prof, but I think it's worth then discussing with our benefit design committee. I've noted the observation. I understand what you've raised.
Hi, Prof and Babalwa.
Hi.
Prof, it is like Babalwa said, we will take this up with the Benefit Design Committee, seeing that you have addressed your concern already in the past, and that we have told you it is because of cross-subsidization, etc. But it is also, you know, the options do get approved by the Council of Medical Schemes. So they do give us guidelines on how we should structure the different options and how the benefits should be applied to those benefits, to the certain options. But I think because you have quite a concern about various things about the different benefits that you've mentioned, we will need to give you an answer in writing. So we will make a note of it. If you can please, like Babawa asked, leave us your membership number, and then we can address all those questions that you do have.
Sorry, if I may ask, do you mind just giving me a phone number? Then I will, because I don't want to share on this open line my benefit, my BestMed number and my email address, because this is open for all to see. So if somebody could just give me a phone number, then tomorrow I will phone and give the information. I would just like to say that I've been advised when I took this up outside of BestMed, also with the Council Ministry, that I should contact the principal officer of BestMed. And I don't want to do this because this might raise quite a number of things. And for me, it's strange to hear, but I do accept to say that the Council of Medical Schemes have approved this, because most of your, let's say, your top competition, they don't have this. So why the council approved this in your case, but in with other medical aids with a top option, this is not the case. I find it strange, but I do accept your word that this has been approved. But I mean, it's pure discrimination, and it's not cross-subsidization, because if you were two separate adults, let's say, for example, a male partner and a female partner having their own separate number, you will still get the same money, and then there's no cross-subsidization of this. Why would somebody who has got a dependent who also pays in full be penalized with the cross-subsidization issue? But anyway, so if I may just have with somebody's number and name, if you won't mind sharing that with me.
Not at all, Prof. You can phone myself, Loretta Lechman, as it stands here on, as it is on the screen. Yes.
Thank you so much. I will contact you then tomorrow, and thank you for the opportunity to raise this, because I have tried, you know, for more than 2 years to get an answer to this. Anyway, let's see how we can move this thing forward, because I believe that this is this does not satisfy the principle of equality, and most definitely cross-subsidization doesn't play a role in this particular instance. Okay. All right, but thank you so much.
Okay, sir. Thank you.
All right. Thank you, Prof. And I think we have then addressed the questions. All questions have been addressed. If there's maybe any questions, I'm sure my colleagues are then already attending to those. I think I've gone a bit over the allocated time. So without wasting any more of your time, I would then like to thank you for joining or taking time to join this evening session. Information session on the Pace4 option. As advised, we are available. If you have any questions, you can then post those or email your queries to escalations@bestmed.co.za, and we will gladly then answer your questions. So from my side, thank you so much and have a good evening.